Alright, so hello everyone. We're going to be talking a little bit about We're going to be talking a little bit about sports medicine today. So for those of you that don't know, consultant orthopedic and sports medicine surgeon, and basically I've been working with athletes my whole life. And right now I'm based out of Fortis Hospital in Mohali, which is in Chandigarh, and I'm heading up the sports medicine part of things over here. And as part of that, we get to look after athletes at the regional as well as the national level. National level. And so if you guys have any questions about sports medicine or want to know about what exactly sports medicine is, please feel free to fire away, and I'll just answer them as we go along. So a lot of people ask about, what is sports medicine, or what sports medicine involves, and the different types of nuances and sort of facets of what is sports medicine. And it's really it's a new an emerging field, even though the classical sports medicine started at the time of the initial Olympics, and it really got a push in the last 150 years. But what we know now about sports medicine is that it's a rapidly evolving field. There's a lot of different facets to sports medicine, and so you can just ask me as we go along, for those of you that are just joining right now. So sports medicine really got a big kick about 100 years, and people always ask me, what does a sports medicine doctor do? So it's not as simple as, just a sports medicine doctor looking after a team or an athlete. So we work in a big environment in which there's multiple players in that team. So when you look at any team, there's not just a sports medicine doctor. There's also a sports physiotherapist, sports nutritionist, sports psychologist. There's an entire family of people that have been built into the system to help athletes achieve their best and their peak performance. So there's even high performance specialists now as well, which are aimed and dedicated at that. So there's a lot of different people that get involved in the care of athletes, and a sports medicine doctor is just one of them. So there's a lot of people that are involved in the sports medicine field, and I hope you guys can hear me better now. And so sports medicine sort of grew out of pretty much general practitioners that wanted to look after their athletes better, and out of their sports medicine out of their athletic people better. And it's merged now where you've got orthopedic surgeons that are also involved in sports medicine and the sort of surgical side of injuries, and you've got actual colleges of sports medicine and various other sports medicine fields which are dealing with the sort of non-surgical side of it. So a typical sports medicine doctor such as myself, I'm from the orthopedic side, so I'm from the side that looks after the surgical side as well as more of the interventional stuff. And at the same time, I'm also involved in the more physiological side, so looking after the care of athletes' exercise, out of their diet and things like that. So that's really what a typical sports medicine physician does. And as sports medicine surgeons, we not only look after their medical side and the health and well-being of the athletes, but we also treat them for once they come to us with injuries. So we get a lot of people that come to us from various fields and facets of life, and as an athlete, and they want treatment for their injuries. So a sports surgeon really steps in at the time when we have to treat their injuries. So we treat them using a variety of methods, which include sort of mini interventional things such as PRP injections and things like that, and a variety of other injections, or through the surgical side. So things like what I do, so arthroscopic surgery of the shoulder, of the knee, and basically bringing an athlete back to their sport. Because at the end of the day, the most important thing for any athlete is return to sport, return to play. And we're all geared up from a surgical point of view to bring them back to that stage. When you're a team doctor, or I've had the pleasure of being a team doctor for a variety of sports teams, and one of the really lovely things about being a team doctor is you get included in the family of athletes. So when there's a team and you're embedded with them as a team doctor, so you live with them, you sleep with them, you eat with them, you're traveling with them, and it's a lot of fun, and you become a part of their family in a way. So you do have a responsibility to treat them and treat their injuries, and you have to work in coordination with the sports physios, who do a fantastic job, with the sports nutritionists, with the sports psychologists, and all the other members of the sports family. Yet at the same time, it's your role to look after their health and well-being by working in concert with all these people. And it's fun. You get to travel with them, you get to stay in good hotels with them, and the fans cheer for them, and in a way they cheer for you as well, because you're looking after their health and well-being. And so it's a very enriching experience, and one which I would recommend that anyone who's interested in being a sports medicine doctor really takes an initiative to do. And I think ISST can help you with that as well, and get you involved in a lot of different things. So we've got a question here. So what are the differences between normal medicine and sports? So Nitesh Pandey has asked, what are the differences between normal medicine and sports medicine, and why we need sports medicine as a different branch? That's a great question. So a normal medicine doctor deals with the entire population. So they deal with everyone who comes into their practice with a cough, a cold, stomach ache, and a variety of other things. A sports medicine doctor is there to treat specifically athletes, because athletes have a different physiology, they have a different set of pathologies that are sports medicine doctors. We're really involved with treating athletes per se. Sports medicine doctors are really involved with treating athletes per se, and dealing with the sort of health and well-being of athletes. Now, as part of that, you have to do a variety of different tasks. So it involves looking after their sort of meal plans, looking after their travel plans, looking after their inflammatory history, their inflammatory profile, dealing with all the data that comes out of athletes as well. So there's a ton of data which is now being generated from athletes. So you would have seen a lot of teams are using Compass or other GPS technology. So that basically tracks the the workload of an athlete, and as sports medicine doctors we sit with the performance specialists and really go through this data, so we can adjust. I'm just giving you an example. So we can adjust their hydration parameters based on how much they're doing, and we're there to prevent them getting injuries as well. So a normal doctor wouldn't probably be involved in prevention of injuries, whereas a sports medicine doctor plays a big role in setting up injury prevention stuff, injury surveillance stuff, and really looking and preventing people getting injuries in the first place. Now, God forbid an injury happens, so a sports medicine doctor in that case is equipped to deal with the injury both on the field and off the field. So you're involved in primary care of the athlete once they get the injury to begin with, and also secondary care of the athlete as you guide them through the entire process of what they need and what not you need. So we've got a question from Manit, which is, can you explain in short about all the branches of sports rehabilitation? Yeah. So sports rehabilitation is really centered around sports physiotherapists. So there's other people that play a part as well, such as strength and conditioning guys, athletic trainers or ATs. Even though we don't really have them in India, they're sort of blended into the sports physio mode. But in the West we did. So we had dedicated ATs, which are athletic trainers for the teams. There's fitness specialists now as well, which sort of consume the role of an AT as well. And so all these guys are really important in the rehabilitation of players after they get an injury. So say as a surgeon, I routinely get people that come to me with injuries, and once we operate them, we work hand in hand with sort of the best sports physio guys in India. So we talk to them before. So we try to prehab the athletes, which means get them ready for the surgery, because the better your body is going into a surgery, the better your body is coming out of a surgery. And a lot of orthopedic surgeons in India that deal with athletes actually ignore prehabilitation, which is a very important part of their care. So if, for example, if you get an ACL injury, we usually like to prehab our athletes for about 6 weeks before we take them into the OR and fix their ACL. So it just leads to better muscle strength, and all the studies have shown that prehabbing your athlete actually improves the time to get them back to sport, and it leads to faster recovery and faster rehabilitation. So that's the prehabilitation part of it. So once we operate them, again, we keep the sports physios in the loop, and we let them know that, hey, this is what we've done, and this is sort of my vision for a rehabilitation program. And it's not that we're rigid in that. So again, orthopedic surgeons are very different. So I'm not rigid. There may be other orthopedic surgeons that are very rigid in their programs, but I like to work with the physios in that respect, because there's a lot of give and forth, and you can't, my philosophy on this is you can't apply one rule that fits all. So an athlete who's a swimmer, after a shoulder surgery, they require a different set of rehabilitation, whereas an athlete who's a volleyball player after surgery. So all of us have to work in concert depending on the sport the most important thing for all of us is that they should be able to get back to that specific sport and be able to play that specific sport. So in the rehabilitation process, we get in touch with the athlete, their coach, their family, as well as with the sports physios. We sit down, we develop a rehabilitation program which not only deals with the physiotherapy part of their injury, but also deals with how these athletes are going to get back into the rehab, into their sport. So the fitness trainers are really important there to help with their conditioning. The strength and conditioning guys do a fantastic job in terms of general conditioning, but really the sports physio is the guy that drives that process. And now with newer technologies and newer ways to deal with injuries, such as cryotherapy and ice machines and things like that, so it's really modulated the way that we approach rehab. So we now have better tools in our arsenal to deal with it, and we also have what's known as biomechanical rehab, which is getting them back from a biomechanical point of view to the level at which they were previously. Now again, how can you know where an athlete should be if you don't know where they have been before? That's why as part of sports teams, now what we're doing is we're trying to intervene early and do a biomechanical profiling of all athletes, so that God forbid, say you're a football player, you have your biomechanical screen done, which tells you that, hey, this is your biomechanical profile, this is your gait analysis, this is things like that. And these are things that we're trying to build into a pre-medical questionnaire, because the pre-medical questionnaires nowadays, they're very dedicated to excluding things which can cause death, such as sudden cardiac death or any heart problems, or any big sort of medical problems that interfere with the athletics. However, what we want to know is their performance level before, and also their biomechanical profile before, so that God forbid they have an injury, we know the previous biomechanical data and we can slowly get them back to that stage as well. So I hope that answers your question about sports rehab. So it's an ongoing process, and as their fitness evolves, as their conditioning evolves, we work with the physios and sort of modulate their program. And our aim, with the aim of any sports surgeon, is to get them back to play. So we've got a question from Soumyajit, which is, do you sometimes tend to prescribe performance enhancers or anabolics in order to improve the performance? Absolutely not. So they're banned by the Anti-Doping Council, and they're banned by WADA as well as NADA, so you cannot do that. And if you are doing that, then please stop, because what happens is that if they pick up any of these things, it's an automatic ban for the athlete. So you're in a way, you're destroying their sports career. And a lot of the problems that we face currently in India is that, say I'm an athlete and I have a cough and cold. So what I'll do is, I'll go to my local GP, or I'll go to my local medical doctor, and they'll prescribe me a set of tablets. Now, one of those tablets may be a short oral steroid to help, with the breathing, with the asthma, with whatever else problem you've got. Now, as soon as you congest or you ingest that steroid, you're actually in a doping purview. So unless you applied for what's known as a therapeutic use exemption, so you've basically doped yourself. Now, if unfortunately you get tested during that time, then it leads to automatic suspension. So it's very important that you're telling athletes, and this is something that we tell all athletes that come into our practice, that your body is a temple. You're responsible for what goes in, and you're responsible for what shows on the outside. So what does that mean? So you're responsible for each and everything you ingest, from your nutrition to your medicines to everything, and each of them should be checked by a sports medicine guy. So they know exactly what's going into your body. They know that you're not self-doping or accidentally doping yourself, and if you accidentally have, then they can apply for a TUE. Now, what shows on the outside is your fitness level, your conditioning level, and those sort of things. So I'll give you an example of, this is one of my favorite examples, because I love watching basketball, and I work with the NBA in India as well as their official surgeon and their official doctor. And I was doing that in Australia as well when I was there. So really one of the key things that we see with one of the players is Lebron James. So he's considered, one of the top 5 players of all time, and he spends about close to $1 million+ on his body every year. So he spends $1 million+ on looking after his body, and again he treats it as a temple. So what goes in, what shows on the outside. And that's why, now he's 36, 37 years of age. He's into his 17th season in the NBA. And he's doing things that, no one's ever done in their 17th season. And that's because his body has lasted him. And he's not had any major injuries in his career because of the way he's looked after his body. So he's subjected to an immense amount of workload over the last 17 years. He typically doesn't try to, buy time out from that workload. But he's been pushing his body all cylinders. He's gone to 8 consecutive playoffs, and he's at a high risk of injury. But the only reason he's avoided it is because he really looks after his body, and he does that during the on season as well as the off season. Okay, so we got another question from Manasi, which is, what are the most reliable recent advances in sports medicine or rehabilitation? So with rehabilitation, it's probably better you speak to one of the sports physiotherapists, but sort of the things that we see from their side is, looking at various ways in which we can promote healing. So things that we're doing now, such as PRP injections or ACP injections or things like that, the whole rationale behind them is because our thinking of tendon injuries has really advanced in the last 10, 15 years. 10, 15 years ago, we used to think that tendon injuries are caused by tendon inflammation, or basically you get a lot of inflammatory cells to the area, which causes tendon problems. Now, as our thinking has advanced, we know that it's less to do with inflammation, it's more to do with tendinopathy or tendinosis, and which is basically a mechanical dysfunction of the tendon. So the tendon sort of starts to decay and degenerate, and it starts to repair itself at the same time. And it's the disbalance between the two that leads to a lot of tendon disorders. During that time, your tendon becomes weaker and at a higher risk of injury. So what we're looking at now is, how can we inject things into tendons to make them stronger, to help with the rehab process. In the past, what we used to do was we used to do steroid injections for tendons, and in a way we were stupid, because what we learned down the track is that, one, it ruptures tendons, and two, steroids are a very powerful anti-inflammatory tool. So if you suppress the inflammation, because again we used to think it's due to inflammation, so we thought, okay, give them the most powerful anti-inflammatory we have, which is a steroid, and try to suppress that inflammation, and it will take away their pain. And it did, but that pain used to come back again, because it's an internal microarchitecture of the tendon that gets disrupted. So the body is trying to inflame that area because it's trying to heal that area. Now, if you sort of suppress that inflammation, you take away the pain for a period of time, but you haven't fixed the underlying pathology. So now we're in the era of pro-inflammatory. So we're trying to actively inject agents such as PRP or platelet-rich plasma, or ACPs, which are release growth factors, which get inflammatory cells to the area in high quantities to speed up the healing and recovering process. So we've transitioned away from sort of, the anti-inflammatory era, and we've moved into the pro-inflammatory era, and they're the sort of things that we're doing right now, which is, and again we're looking at gene therapies. So we're trying to understand the genetic makeup of athletes, and to understand that, is there genes which lead to higher performance in some versus others, and also understanding that how these genes affect metabolism and how they affect exercise physiology. Okay, so we've got a question here from Azania, which is, sports medicine has an important role to play in all sports. That's right, especially in football, that requires, you're absolutely right. So Srihash, how would you evaluate the modern tennis greats playing on and not stopping? like with anything. So if you see, Roger Federer, Djokovic, and the sort of way they're pushing their bodies right now, and this is something we talk about in all of our sports medicine conferences as well, which is the athlete of today is vastly different to the athlete of 20 years ago. So the amount of workload and training hours and the fitness levels and the conditioning levels that we're seeing in the players today, and that's a natural evolutionary thing. So you would expect that, with evolution, athletes would continue to improve and their performance would continue to improve. But we're seeing it in such a short time is because there's a lot of science that goes behind it, and that's what sports science is about. And peak performance is really about, is understanding, how we can, in a legal and safe manner, improve performance in athletes through various methods such as conditioning, nutrition, things like that. So by doing that, we're making athletes stronger and better and faster. And there's a really good TED talk on this, which you should watch as well. It's can't remember who said it, but they had a very good description of how athletes and their bodies have developed over time, and it's a fascinating view. So I'd suggest you to look at that. So we've got a question here from Abhi, which is there any difference between dietitian and a sports nutritionist? Which is better for the career? Yep, so dietitians again are going to be dealing with all sorts of injuries. So dietitians deal with your regular people, so such as obese people that are trying to get thin people that are trying to get fat, and the whole sort of gamut of the general population. Now the difference with a sports nutritionist is they really understand sports physiology. So they really understand what makes athletic bodies tick, how the metabolism of an athlete is different to the metabolism of a general population. And so when you're working with a sports nutritionist, they're really in tune with that, and they really understand that, and they're really trying to give you things and put things into your body from a nutritional standpoint that they make you stronger, faster, bigger, but at the same time they're also not compromising on your performance. So they're trying to build your performance through the things that they're putting into your body. So definitely, for our athletes, we get them in touch with sports nutritionists, and we guide them to some sports nutritionists we know, and they are able to develop specific plans which are individual to the athlete and individual to the sport as well. So Ajinkya has got a question here. So what's the role of sports massage in sports medicine? Okay, so sports massage is I would say an evolving field, but it's well entrenched in the sports community. And so if you look at the real evidence behind massaging, there's not a lot of evidence there, high quality evidence, which we talk about, things such as randomized control trials that compare massage to non-massage and things like that. There is some amount of low level evidence and a lot of anecdotal evidence which does indicate that massage helps with preconditioning of athletes, and that massage does help with the post-play recovery of athletes. So massage definitely has a role, and I know some great masseuses, and they do a great job, and athletes are really happy. So if you spend any time with a team, one of their favorite parts is heading over to the massage guy or the massage girl and getting a massage. It helps their bodies sort of condition back, and gets them cooled down after a game as well. So there's a lot of anecdotal evidence, and there's a lot of low level evidence for massage, but there's not a lot of high quality evidence for massage and its role in injury prevention in sports. So Shirin's got a question: what evaluation procedure can we do to evaluate the player for his general fitness towards the game? So one of the things is that we're working, and FIFA's been doing this for a long time, which is a pre-participation medical questionnaire. So that means any athlete that goes into any team for any sport, they basically have to run through a set of tests and questions, and we do an ECG, a 2D echo, and then if we find some abnormalities, we do some further cardiac testing as well. But we do a sort of a blood count, some basic profiling of them, and we also look at their physiology from a simple point of view of just asking some questions. So what we do know is that if you do that much, you can basically pick out, you can't pick out injuries, but you can pick out which ones are the ones that you need to sort of exclude from a sport due to something. and it also helps you, better understand the athlete and provides you with some baseline data. In terms of checking on their performance so we use a lot of various things such as time tests, and that's all again done mostly by the sports physios. We use a lot of the Compass software as well to help us with determining their sort of pre-play level of fitness. We do hydration parameters for athletes. Now we're also incorporating more stuff about inflammatory blood tests just to get an inflammatory profile as well of the athlete. And so these are sort of the things that we're looking at in terms of getting a baseline sort of data. Okay, so Reynolds says, is there tips for boxers or boxing athletes? Yeah. Is there any specific thing that you want to know about boxing, or because it's a high risk sport, you're punching people in the face all day, so you're bound to get injuries. So do you have a specific part of that? So Nitish has asked that there are some components in some medicine which are banned for athletes, like we saw in Prithvi Shaw. Yeah, so Prithvi Shaw, that components are bad for normal person's health. Yeah, so Prithvi Shaw's case is basically something that we talked about already, which is athletes, at the end of the day, any athlete is responsible for what goes into their body. So they're responsible for what they're taking in, what they're ingesting. And if they're doping themselves, some athletes do it. So remember, a lot of these athletes, their whole life, they've just been playing sports. So they've been doing a little bit of academic work, enough to get by, but the majority of them are just playing sports. So they really don't understand, and they're too young. They're about 18, 19 when they're coming onto the scene, and they don't have a really good understanding for things such as doping. And so the BCCI does a great job in that regards with imparting doping education to them. But again, there's a room for moving it down to Ranji and other teams as well, and to other sports as well in India, and really teaching them about doping. So and Prithvi Shaw's case is a beautiful example of that you take something which you think is fine and it's just a regular thing, and you come out with a dope test positive, and it destroys your career. So he's had a big setback from that, and I think it's a wake-up call for all athletes in India that you're responsible for what goes into your body, and if you're unsure about anything, just give a sports medicine guy a call. Let them know that, hey doc, this has happened. My local doctors told me take this. Do you think it's okay? Can I go ahead and take it? So I'll give you an example. We had a national weightlifter here. So he'd gone and he'd shown a local doctor in my area, and that local doctor had given him some tablet to take, which was on the list of banned substances. And I mean, the local doctor did it with his best intention. He just didn't know about the list. The athlete also took it with the best intention of getting better for their specific problem. Now this guy got dope tested, and he basically is now banned for the next 5 years, and they're still fighting the case. The people that are looking after him are still fighting the case with the National Council, but basically it's a setback for him, because what being excluded from sports does is it demoralizes you. So when you're sitting outside, you're not sure about that, hey, am I going to be playing again? Am I going to be missing the next 2 Olympics because of this? It sort of becomes a huge roadblock to your career, and mentally you just don't know that can I go forward from this or not. So psychologically it has a big impact on athletes, which then leads to impact with their conditioning and other sort of things. And it's really hard to keep an athlete motivated during that time, because they're depressed. They go into depression, and they're just thinking that I'm never going to be able to play this sport again. So that's why we say it's really important, be in control of what goes into your body. And if you're unsure, just talk to a sports guy, and just a sportsman guy, and just say that, hey doc, I'm going to be taking this. Is it safe, or do we need to apply for an exemption, or is there any alternatives that are not going to get me on the dope list? So Murad has got a question, which is the smoking affect the recovery from the sports injury? Absolutely it does. Smoking is known as one of the biggest risk factors that delays healing and delays recovery, whether it be from bony injuries or from muscle injuries or tendon injuries. And the good thing is that a lot of athletes don't smoke, because smoking does affect performance. So a lot of athletes are non-smokers by virtue of just being an athlete. So we see a lower incidence of them being smokers. It's actually higher in the general population. population. So but if they are smokers, we have to tell them to abstain from smoking, especially after surgery. So especially after we're fixing them or we're injecting them, we really have to tell them that, look, for the next 6 weeks you're not allowed to smoke. And some people give them nicotine patches as replacement, but it actually doesn't work, because the problem with smoking is not from the lung cancer or from the tobacco. For an athlete, it's from the nicotine. So nicotine constricts your blood vessels, reduces the supply of sort of good stuff to the area that you need. So if you put them on a nicotine patch during that time, you're still putting nicotine into their body, which is a powerful vasoconstrictor. So you just have to tell them to abstain and do something constructive during that time, and try to sort of psychologically motivate them from getting out of that smoking episode. But again, it's a rarer thing we see in athletes, because they're smart enough not to smoke, because it impacts their performance. So Manasi's got another question. Can you guide us about career opportunities for women physios in sports practice in India? Immense. And I think the next 10 years is really going to see an uptake in both sports medicine and sports physiotherapy and the other sports medical branches in India, because a lot of sports is being played. And if you look at the West, and if you look at say the States or Australia, where I was for 25 years, the sports medical team for any sort of big sports team consists of a sports medicine doc, a couple of sports physios, a sports nutritionist, an athletic trainer, and they usually have a sports psychologist on standby. So for the women's team, we typically prefer there to be female physios, just out of comfort. And a lot of the times and there's a lot of great female physios in male sports as well, but one of the things that we see or that I've seen in the Indian practice is that a lot of the Indian players are sort of shy and letting female physios work on their bodies, because physio is a sort of a deep science, and so working on their bodies, sometimes they can get uncomfortable. So there's a lot of female sports that are being played. As you know, there's a lot of women's cricket, women's football, and a lot of other female tennis. And so there's a great amount of sport being played, and female physios are going to have a role there, as well as for men's teams as well. So they already have a role in men's teams and men's sports, and I think for female sports as well, that a lot of females will be much more comfortable with the female physios. It's just the nature of things. So having said that, we've seen some great female physios working with the male teams, and they really do a great job. So, and it's really difficult as well for them being away from their families, like it is for the male physios as well. So I think that if you look at the next 10 years, there's going to be a lot more jobs for sports physiotherapists. There's going to be a lot more jobs for female sports physiotherapists, and there's going to be a lot more jobs for medical personnel in general that are involved in sports care and the care of athletes. So I think that the next 10 years is going to be a good time to be in India, to be a sports medicine personnel. So one of the things, while I've got you, that I wanted to tell you about is that ISST Pune is running a distance diploma in sports medicine. So it's a really good educational program that we've set up using some of the best faculty in India, and it's a correspondence program. So basically it's a 6 months course. They send you out a set of videos and course material, and you can just read it and go through it at your own time. And that way it allows you can learn a bit more about the sort of specifics of sports medicine. So the history, what sports medicine guys do, the role of sports nutritionist, what is sports nutrition, sports physio, the basics of it, dealing with upper, lower limb injuries, and a variety of other topics like that. And it runs over 6 months. There's a couple of exams you have to give, and it becomes really something that's good for you to learn. It helps you improve your baseline theoretical knowledge as well as some practical knowledge. And I would encourage all of you, even if you don't want to do it, just have a look at it once and see if that's something that interests you or excites you. And especially during the lockdown now, we're all free, so this is a really good time to spend your time doing academic things. So spend your time going through the course material and learning it, and you can give your exam and go ahead from there, and it becomes a nice little tool to add to your kitty bag. So Subatra's got a question. How scientific approach of sports training can be brought to the grassroots level? So I think that's already been implemented. So it's implemented obviously at various stages in various sports, and football does a really good job of it, more than other sports, because they have a lot of grassroots academies. So the sort of specifics of sports training and sports trainers working with athletes, as junior coaches develop and they learn things from the senior coaches, that sort of titrates down that system. Now football is a huge sport, so there's a lot of people that play it. In India there's a lot of teams that are involved in football as well. They have a lot of junior academies, same with cricket, same with the BCCI. And so when you've got sports trainers teaching their junior staff, you've got sports coaches of the higher teams teaching their junior staff, that sort of percolates down the system. How can we help? As sports medicine guys, how can we help? We can help by running education sessions for these people at the grassroots levels, especially for the grassroots academies. And that's a way of sort of mass communication. But remember, whatever you learn in sort of a 1 hour lecture or a 2 hour lecture or workshop from any sports medicine guy, it's hard to translate that into practice unless you've got a good teacher or someone at the grassroots level who's continuously hammering that into you. So a lot of the times we go to places and they're surprised, and they're so interested to hear about things that we've got to say, but it's they may forget it, or they may just not have time to incorporate it. If their sports trainer or if their coach takes it seriously, then it does enter into that system. So it's really about getting the sports trainers and the sports coaches on board, because if they dedicate even 5 minutes of their time to injury prevention, it goes a long way towards injury prevention. Simple as that. So Subatra's got a question. Many talents in India get lost due to non-scientific approaches. Yeah, I would say so. And a lot of talents in India in the past used to get lost to injuries. So now luckily we have some very good sports medicine physicians in India. We have some very good sports physios in India, and I'm blessed to work with a number of great sports physios in India. And we also have some very good sports orthopedic surgeons in India. So we're into the era where we have access for, probably I would say, the higher up athletes to all these services. And in the next sort of 10 years, as the amount of such personnel is going to increase in India, you'll see that the access for lower levels of athletics, so younger teams, junior teams, they're going to start approaching these people more and more, and being able to deal with injuries at an early stage. So we get a lot of people that come to us that are sort of 15, 16 years old with injuries. Their parents are worried a lot that, is this going to impact performance? Is it going to mean that he can't sort of get to that level to play in sports in the future? And so we sort of guide them and handhold them in that journey, and get them through that period. So again, that's us doing it here at Fortis in Mohali. But again, it's hard to get that access in smaller towns in tier 2, tier 3 cities. Chandigarh is a tier 2 city, but we have some really good access to resources here. But again, I do understand that in tier 2, tier 3 cities, it's really hard to get that sort of access. So I think that as time goes by, and you're going to see more sports medicine physicians and surgeons and sports physios going into these towns, into these smaller cities, the access for those sort of athletes to that level of care is going to only improve, which is overall going to be a great thing for sports in India in general. So they're helping promote the field of sports science. It's probably not introduced by them, but they are definitely one of the big players to help bring sports science and its education to people of various walks of life, and that are dealing with sports and athletes, and getting them involved in the care of athletes and their injuries. So yes, definitely most, I would agree. So again, we have that sports medicine course, and we'd highly encourage you to just have a look at that and see if that's something that interests you, and I think that'll be good for everyone. I like to say thank you to everyone for giving your time and coming out to this session, and I hope you learned something and you had some of your questions answered, and you can take that back. Again, at ISST Pune, we've got the diploma in sports medicine, so you can learn a bit more about that by going onto their website. And I'm here at Fortis in Chandigarh, so if any of you has any questions, they can just send me a text or message me, and let us know about that. So great. So thank you very much to everyone, and I hope you have a good evening, and please get in touch if you want to ask anything, or if your players want to ask anything, if your coaches want to ask anything.